Welcome back, Titans, to another episode of EMS Lecture Series for SPC's EMT and paramedic programs. Today we are talking about amiodarone or amiodarone hydrochloride. So that is the generic name. You also may see it as the brand names of Cordarone or Pacerone. What is amiodarone? Amiodarone is part of the class of antiarrhythmics, specifically class 3. And this is what we're going to see used in the pre-hospital settings for irregular heartbeats like VFib, VTAC, irregular rhythms rather, and cardiac arrest, but we can also use it for patients that are still conscious with a pulse. And we'll get to that in just a minute. So let's talk about the mechanism of action real quick. So mechanism of action. So what amiodarone does is when we deliver this to a medication to our patients, it's going to block the sodium, potassium, and calcium channels, and it prolongs the action potential duration and delays repolarization. It's also going to lower AV conduction and SA function. What does that mean? It's going to work on the nerve tissues in the heart. It's going to slow conduction down. Usually when we're giving this medication, it's either irregular or it's very fast, and that's what the object of it is. So, indications. So, VFib. VFib is one of the items that we can use this for in a cardiac arrest. That's going to be IV push. We also have pulseless VTAC. We can use it to control AFib RVR without pre-excitation, stable wide complex tachycardias, polymorphic VTAC, or what we would call torsades with a normal QT interval. Let's talk about the contraindications. Anytime you have an indication, you have to have a contraindication. So obviously, if we have a hypersensitivity or an allergy to it, if your patient is in cardiogenic shock, sick sinus syndrome, or second or third degree AV blocks, that's going to be contraindicated for this medication. Are there any adverse effects? So adverse effects, amiodarone has a potential to lower blood pressure, cause heart failure, prolonged QT, dizziness, fatigue, nausea, vomiting, all the other sorts of things that come with antiarrhythmics like this. And it can also lower heart rate. Why? Because we're working on the nerve tissues in the heart. We're trying to slow conduction through the heart, so obviously it can lower the heart rate, but it's an adverse effect. Talk about the dose. So the dose for adult VFib or pulseless VTAC, we're going to give 300 milligrams IV push. And that's why I put this right here. In cardiac arrest patients, we're going to push amiodarone. It is going to be 300 milligrams for your first dose, and typically 150 milligrams for your second dose to a max of 450. Now, we can also use it for stable VTAC. If our VTAC up here did have a pulse, and per ACLS standards, if they were stable, this is when we're going to drip it in. This is when we're going to hang a bag of amiodarone, which typically is 150 milligrams or 3 mLs in a 100 cc bag, and we're going to do that over 10 minutes. So now that we have some of our doses, let's talk about the duration of action. So when we're delivering this medication, typically per Nancy Caroline, 9th edition, it says that the onset is about 2 hours. Peak is going to be 3 to 7 hours, and the duration can be variable depending on the toxicology in the patient, pH balance, and everything going forward with that. So any special considerations? Of course, there's always special considerations when you're giving an antiarrhythmic. For pregnancy category, it's a D, because it may cause fetal harm. So use caution in that. Always follow your local protocols and treat your dysrhythmias. So hope this helps. A quick overview, and in our next video, we are going to be actually preparing meds and doing drips. So stay tuned for that. Thanks.